Hello, today I'm going to talk to you a little bit about maple syrup urine disease. So, to start with a case study, maybe. There we go. There was a baby that was delivered normal and healthy via a vaginal birth. On his newborn screening, they found they had increased amino acid levels. They did a little bit more testing and found that he had actually increased levels of leucine. And at that point, they just kind of watched it. At his 2-week checkup, he came in and he presented with irritability and poor feeding habits. His vital signs were stable. They did a little bit of blood work and they found that he was acidotic with a bicarb level of 14. He was had some ketosis, and he also had elevated ammonia levels at 83. They did an MRI and found a little bit of diffusion in some specific tracts. And he ended up diagnosed with maple syrup urine disease. So what is maple syrup urine disease, or MSUD for short? It is a deficiency of one of the enzymes called the branched chain alpha keto acid dehydrogenase. And this enzyme is responsible for breaking down leucine, isoleucine, and valine. So without this enzyme, you are unable to break these 3 amino acids down, leading to a buildup of them, and the buildup of these 3 ends up being toxic to your system. The history of MSUD started in 1954. Dr. John Menkes had a handful of patients, 4 of them specifically, that had similarities. They all included a healthy birth, an onset of these symptoms within 3 to 5 days, a very rapid progression of the illness, often to death. They had difficulties in feeding, loss of certain reflexes, and some difficulty of breathing. Most specifically, in all these patients, though, was the unique sweet scent of their urine. There was also a mother of one of these patients that had noted that she had 2 other children with these same exact symptoms. Both of them died very shortly after birth, and they also had that same sweet-smelling urine. So he noticed a trend. He logged all of these similarities and then published the first article referencing maple syrup urine disease. Back then, they hadn't called it that yet, though. And his article was titled "A New Syndrome, Progressive Infantile Cerebral Dysfunction Associated with an Unusual Urinary Substance." So fast forward a few years, you've got Dr. Joseph Dancis, and he and a few colleagues did a little bit more research into the condition. And in 1959, he published, I'm sorry, 1960, they published an article called Maple Syrup Urine Disease. So they were able to identify the exact cause of this condition, and it stemmed from, they found abnormally high levels of leucine, isoleucine, and valine in these individuals' blood plasma levels. They eventually found the cause to be the faulty enzyme that I mentioned in the last slide, that BCKDC complex. So the molecular cause of MSUD is a mutation of 3 different genes that are all involved in making this enzyme complex. So the first is the BCKDHA gene on chromosome 19. The second is the BCKDHB on chromosome 6. And then the last one is the DBT gene on the first chromosome. Some signs and symptoms of maple syrup urine disease. They initially present with lethargy and irritability, very poor feeding habits, some nausea and vomiting. Then they eventually will end up with some loss of coordination, seizures, coma. Death is obviously also one of the, I don't want to say symptoms, but that can happen. And most notably is the odor in their urine, earwax, and it kind of smells like maple syrup. There are 4 different types of maple syrup urine disease: the classic, the intermediate, the intermittent, and the thiamine responsive. Which type you have is determined by how old you are when the symptoms start, the severity of the symptoms, and obviously if you respond to thiamine or not. The classic type is the most common and also the most severe. Maple syrup urine disease is an autosomal recessive disorder, which means that you can be carriers and not have the disease. It also means that in order to have the phenotype, you have to be homozygous for the recessive gene. So in order to have that, both of your parents would have to be carriers, or they won't have to be carriers. You could have a parent that has one, but at least each of them have to have the recessive gene. And if that were to happen, then you would have a 25% chance of having a child that has this disorder. Here's just a simple pedigree. So the parents are up on top. One is homozygous for the dominant, one is heterozygous, and they have 1, 2, 3, 4, 5 children. One of the children is heterozygous, marries another individual that is heterozygous, and then they have 2 children. And because they are both heterozygous for that recessive gene, one of their children ends up being afflicted with the maple syrup urine disease, and then the other child is a carrier. So to diagnose MSUD, there are really only a couple of different ways. The first way is to assess the urine and blood plasma levels for the levels of these amino acids. Second, further on down, is to do an MRI of the brain to see whether or not there is edema in specific areas of the brain. Genetic testing for the disease is done as part of newborn screening, so it's done in almost all of the states now. If it's not done as part of the newborn screening, you can also get testing, and there are several tests that are done for this, 98 to be specific. You can get the maple syrup urine disease panel, the maple syrup urine disease biochemical genetic testing. You can get DBT complete sequencing and a handful of other ones. Most of them are covered by insurance. If your insurance doesn't pay for it, it's normally a nominal fee. I think I read anywhere from like $15, maybe up to $100. Treatment is pretty basic. The most obvious is a change in the diet. If you can't break down these 3 amino acids, then it's just easiest not to take them in. So a strict vegetarian diet, protein is very high in all kinds of amino acids. So if you stick to a vegetarian diet, you are less likely to be taking in these amino acids. So that helps in almost all of the patients. If for some reason you are taking in these amino acids and you go into a metabolic decompensation, dialysis is a really good way to go ahead and rid the body of these specific amino acids. Lastly, in really, really severe cases, a liver transplant. And a liver transplant will be able to hopefully correct the enzyme deficiency and then allow an individual to actually break down these 3 amino acids. And that is all that I've got. Thank you very much.